Good afternoon, all. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Welcome today to our virtual town hall on January the 28th. We'll provide some updates and information in relation to the ongoing pandemic response at HHS, as well as other matters that are important to what's happening at this time. We have a number of speakers lined up today, and after that, we'll have time for a question and answer. Would request that everybody please hold your questions to the best that you can until the presenters are done, in the event that the information you're seeking is actually covered in their presentations. But otherwise, we'll ask you to use the Q&A forum when the presentations are done to pose questions, or you can always raise your hand and do so live. So to kick things off today, I'm going to invite our President and CEO, Rob McIsaac, to give us a bit of an overview of what we're talking about today. Over to you, Rob.
Yeah, thanks very much, Aaron, and welcome everybody to our regular weekly town hall. Just this past Tuesday, some of you might have joined us for a special town hall about new provincial directions we received regarding vaccine distribution. These new directions are in response to reductions in shipments of the Pfizer vaccine to Canada over the coming weeks, which has been extensively covered in the media. As we shared at the town hall and through our other HHS communication channels, the province has provided very specific instructions regarding the allocation of existing supplies in our area. We'll summarize the details again for everyone in just a few minutes. I think the main message that I want to convey to all of you is that our goal remains to get the vaccine out to everybody at HHS as fast as possible, of course, contingent on the availability of the vaccine. Our vaccine logistics team is currently planning and working to reschedule second doses according to the province's direction, to extend the interval between the first and second doses to 35 to at maximum 42 days. The team is also doing modeling and planning for how we can scale up the clinic when more vaccine becomes available. We're confident that we will be fully ready when the supply of vaccine is stable to ramp up our vaccination efforts. We're all eager to get going on a full-scale rollout of the vaccine as soon as possible. In the meantime, if you haven't already, you're encouraged to register to receive the vaccine, and details are available on our website. Our current circumstances surrounding the vaccine would not be anybody's first choice, but like many other situations we've had to deal with in this pandemic, we're making the best of the situation that we're presented with. I know I speak with everyone involved in the vaccination effort in saying how much personal distress we've felt because of the slowdown in both first and second doses. I met as recently as last night with the most senior officials of the province, pressing the case for hospital workers getting vaccinated as soon as possible. So thank you everybody for your patience and continued support of the people we're serving and each other. So today we're going to start with pandemic response planning, move on to an epidemiological update. We'll give you some more details around the vaccine, talk about mental health resources, and as always, we'll have time for questions and answers, and also hopefully some celebrations. So with that, I'll throw it back to the team.
Hi, good morning, everybody. Sharon Pearson here. Just going to give you an update today on our pandemic response planning. And it sounds a little bit like the updates I've given the last few weeks, but really wanted to reinforce that HHS continues to participate in the objective of the province, which is to balance our census across our hospitals across the province. And so we're doing this at a local level, we're doing it within HHS, and we're also doing it regionally and provincially. And the objective is to ensure not one hospital is unduly burdened by the volume of patients, be they COVID or general activity. So we do always endeavor at HHS to try to maintain that 15% surge capacity, which, as I've mentioned previously, is about 150 beds at HHS. We have almost 90 patients today, so we have a fair number of those beds filled today, but we're always forecasting and looking out as to where we'll create the next new additional capacity. We, over the course of the last week, we have seen more patients coming into the Ontario West region. And today I did include the numbers so you can see that distribution. There are daily, if not more frequent calls between the hospitals and with the region around who has the capacity to accommodate the patients. So you can see the number that HHS did accept to the Hamilton Journal. So we did accept 5 patients. And really, we're doing our best to maximize the available space we have to ensure that the central region of our province gets some relief from the volume pressures that they're experiencing. We still internally have substantive pressures of our own with our occupancies, particularly at the JH and the general site, well above 100%. And we still are only at 85% of our surgical activity. So day to day, we're assessing our capability as far as elective care goes. If you could go to the next slide. Obviously, a big contributor to our pressures include volumes, but also the number of outbreaks we have. And you can see the sites that we currently have outbreaks. A few of those sites have more than one outbreak. Really at the Juravinsky, we are challenged particularly with an outbreak on our surgical units, with 3 surgical units in outbreak right now. And I know the teams are doing their best at all of the sites to maximize capacity where we can and not impact flow. And I do appreciate it is extremely challenging. We have opened additional beds at the St. Peter's site in efforts to relieve some of the pressure and improve the flow. We are a bit doubly challenged with some outbreaks we've been having at the satellite health facility. So doing our best to work with our partners in the community to improve the flow. We are seeing a slight creep in our ALC numbers above the 200 mark. But I think everyone fully appreciates the situation in the community. There's some 59 outbreaks in different settings in the community, the majority of which are in the long-term care homes and the retirement homes. So we are seeing our discharges slow down into those settings, perhaps a little bit more so than even through other periods of the pandemic. The good news story is Grace Villa did come out of outbreak on January the 19th, and that's due to the awesome efforts of the HHS staff that went in and assisted the home. We will continue to work with Grace Villa for still a considerable time. We have leadership presence at the home, and we will maintain that oversight presence for the upcoming weeks into months. But a really positive story about what happened as a result of HHS staff assisting our partners in the community. So a few staff left. I think there's about 5 staff left at Grace Villa, and we'll work over the next few weeks to bring those staff back to HHS. So with that, I'll hand it back to Erin, and happy to take questions later on about our capacity across our sites.
Thanks very much, Sharon. I think next up on our agenda is Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, to give us an update on the epidemiology of COVID-19 across the country and region. So Dominic, over to you.
Yeah, thanks, Aaron. And at least for the first figure here, you're well familiar with. Unfortunately, public health changed the order, so it will look slightly different this week than the figures you may be used to see in the meantime. So map of Canada with the cases per 100,000 per week in those black circles and the arrows with the RT value. And as you know, below 1 means that the overall trend is going down. And you can see that's true across the board, other than Manitoba, which is currently sitting at pretty much 1.0. Saskatchewan, still the province with the highest number of cases per 100,000 per week. We are sitting at 113 in Ontario at this point of time. Next slide. This is our epi curve, and please disregard the last 1 or 2 data points here because there will be new cases added there. But what you can see is we had that clear post-holiday peak that we all expected to happen after a dip during the holidays that I talked to previously. Bottom line is we are now where we had been before the holiday peak. So from now on, we hopefully go further down into where we had been back in November. But currently, I would say our epidemiology is very similar to where we were at the beginning of December, looking at the Ontario-wide picture here. Next slide. In terms of hospital admissions at the provincial level, we now see a decrease as well. And I mentioned previously, typically it takes 1 to 2 weeks from your peak in number of cases until you see the number of hospital admissions to go down. And with ICU, there's even more of a delay, and that's pretty much what you see here. So we are past peak in terms of hospital admissions with COVID. We aren't past peak yet with the ICU admissions. So currently still at the peak, but it doesn't look like it's increasing any further at this point. Next slide. Now, from a Hamilton perspective, this is our epi curve in Hamilton, very similar to what I've shown you with the provincial picture. We had that post-holiday peak. Now we are back where we had been beginning of December. Trend continues to go down. And again, reminding people, this is overall number of cases. A large proportion of those are outbreak related, which results in a lot of up and down because these unexpected events, I would say, can suddenly increase your number of cases on a given day by 10 to 20 more than the day prior, while the community baseline risk remains the same. Next slide. In number of patients admitted, you can see that in Hamilton, we are actually at the new peak. And as previously mentioned by Sharon, I think it's a combination of outbreak cases that have to stay in hospital, not necessarily because of the COVID infection, but because they are our patients and had a reason to be in hospital. And then relatively small numbers, but nevertheless people that we would accept from other regions. So we haven't peaked yet, I would say. Hopefully this is our peak and it will be going down from now as well. In particular in the ICU, again, you can look at that black line and the dark red bars. We are clearly at the peak in terms of ICU capacity used for COVID patients currently as well in the city of Hamilton. Next slide. I've shown you this a couple of weeks ago. There will be new modeling coming out today, which will hopefully have scenarios other than an increase from 0 to 7%, and hopefully model out also what happens if we continue to decrease. As you can see on the next slide, we are faring much better, as you all know by now, than the best case scenario that was presented in the last models. So we are roughly sitting where that red line is going. As I said, we are lower than we had been by mid-December, which you see at the very left-hand side here. And I will share today's models then coming week here at the town hall as well. Next slide. Now, we had a lot of questions and many people are concerned about the variants. And I spoke to the variants previously to give you like a rough understanding of what it may or may not mean for us. I will focus on the UK variant because that's the one we A, know is in Ontario, and B, we are most concerned about because of that. Plus we have the most data from the experience in the UK and Ireland. This is the table as per 2 days ago. On the next slide, you will see that we are far higher than the 34, certainly above 100 with 99 alone related to or associated with the long-term care facility outbreaks in Simcoe, Muskoka. We haven't seen any in Hamilton so far. Next slide, please. but also appreciating that not every positive gets sequenced. I learned today that by next week, apparently every positive will go out for sequencing. So we will have much better data, I would say, in 2 weeks from now. In the interim, what I can tell you is that we sequenced all the specimens from the original large outbreak we had at the Churowinski back in December, and we haven't identified any variants of concern there, neither the UK variant, nor the South African, nor the one from Brazil. Sequencing in the hotel facility is currently in the works. That will give us a little bit more up-to-date data. But as I said, a couple of weeks from now, we will have much more comprehensive data on sequencing, and we'll know better to what extent this variant is in Hamilton. I think we sort of expect it to be here, given that it's pretty much everywhere as well. But we only see, and that's the next slide, the tip of the iceberg really with the sequencing. And the question is, how much of this variant is already here that we haven't noticed yet? Next slide. Question that always comes up is travel restrictions, and there's certainly different opinions around that out there. We are looking at, that's what's been reported, 143 airplanes with at least one positive passengers over 2 weeks in Canada was one of the headlines. During that same time period of 2 weeks, we had 100,000 confirmed cases in Canada. So if you want to restrict travel to reduce number of cases, it's obvious that the numbers are negligible. It's less than 1% in certain provinces, maybe 2 to 3% of all positives that are travel related. Travel related, as per public health, includes any travel, also interprovincial travel and not only international travel. It may, of course, theoretically prevent new variants from becoming endemic in Canada. As you see for B117, that ship has sailed, it's here. We cannot prevent that from entering. The other challenge that we have as Canada, and that's just a reality, we have essential travel that will continue, and I have in mind in particular the truck drivers. So whatever makes it into the US will likely make it into Canada at some point as well. You may be able to delay that with, in particular, testing at the border, which I think makes sense, whether you need to restrict borders, as I said, different opinions out there. Next slide. Public health measures, that's the other question. Now, if you have that UK variant here and it's already spread to an extent that we are not able to stop it, or not better to stop it, then we have to stop all our other variants. Do we need to do more? Now, this is the UK, or no, this is Ireland here, where you have had an increase from 8.6 to 25% of all positives being the UK variant towards the end of the new year. And during the same time, you see that huge peak up to 70,000 new cases per day from a low of 3,000–4,000. And this was heavily attributed to this variant. It may be a coincidence to some extent because you see those arrows, that's the lockdown measures. So they simply went from a relatively heavy lockdown into releasing pretty much everything prior to the holidays. And you saw what happened here in Ontario with lots of measures in place, but the holiday gatherings kicked in nevertheless. And then you see that huge peak, and all they did now is they do the same that they did previously in October, and the number of cases come down much faster than what we see here. So it looks like the same old measures work for the UK variant as well as it did previously for all the other variants we have had to date. Next slide. So what to do? The same, just more of the same. It still works. Reduce your social interactions, physical distancing, masking when you cannot distance, hand hygiene. For healthcare, probably the same. We don't see any needs at this point or any evidence that the UK variant would spread in any different way than the current variants. We have a PIDAC meeting tomorrow. PIDAC is the Provincial Advisory Committee to Public Health on Infectious Diseases, where we will discuss this particular issue, whether any recommendations for healthcare should change in the light of the UK variant, and more will come on that. Thank you. I'm handing it back to Aaron then.
Thanks very much, Dominic. It's like hot potato. I pop up just to pass the baton on now to my colleague, Leslie Gauthier, our Vice President of Clinical Support Services and Surgery, who's playing a leading role in the vaccine distribution planning that's ongoing. So Leslie, over to you for an update on where we're at this week.
Thanks, Aaron. So again, I'm going to start with an acknowledgement of how disappointed everybody is that we have had to pause our first and second doses of vaccinations to all healthcare workers. Again, this is from provincial direction, and included are the workers within our hospitals, but also the workers in long-term care and retirement homes. So the province has made it very clear that the priority is getting our residents of long-term care and the high-risk retirement homes vaccinated. In terms of what does it mean to people at HHS, people should have received either a text or an email yesterday advising them that the pre-booked appointment has been canceled. There will be a second call when we start to confirm the rebooking. So we don't yet know our supply chain of when the rest of the vaccines are coming in. As soon as we know what's happening, people will be reaching out to book your appointments. We're really asking for people to do absolutely everything possible to be able to accommodate that booking of the second appointment when the clinic reaches out to people. Have absolutely been hearing concern from people. You know, I thought it was going to be in 21 days or 28 days. It's to reassure people, and Dominic's on the call, can speak to specific questions, but the province does have experts from WHO, the CDC and NACI, all of whom are saying the protection will be there with the extension out to 35 to 42 days. And that is what we are currently working with in the planning. I don't want anyone to think we're forgetting people. There's a very big spreadsheet. We know who got first doses on which date. We know where day 35 is, and that's all part of the planning work that is going forward. Next slide, please. This one I can now say in my sleep. I just need to remind people of the sequencing framework when we start back. This work, again, is aligned to the provincial framework that was published in mid-January. It's also work that we are doing consistently with St. Joe's. So we have a group that have worked together to ensure that Group 1 represents like teams in both organizations. So this is not a question of who's more important. It's not a question about individual members of the teams. It really is, how are we going to sequence getting needles in arms? Absolutely, anyone who wants a vaccine will be vaccinated as our supply chain permits. This is really about how we're going to sequence. So Group 1 is the people who are at the highest risk every day when they come to work of COVID exposure. Important, not everyone's at some risk. This is our highest risk teams, which everyone is in agreement is the emergency departments, the COVID units, the ICUs. Group 2 are teams who work with patients who are at the highest risk. Every patient's at risk of COVID, and what it might mean, these are our most vulnerable patient groups. So patient populations like hematology, oncology, dialysis patients, our frail elderly. The majority of our patient-facing teams at HHS fall into Group 3. So forward-facing, you care for patients every day. You have all the appropriate PPE to provide that care, but there still is an element of risk in everyone's work. And then Group 4 is all other hospital workers So we refer to this team as non-patient facing administrative teams, back office teams, non-clinical teams in sequence group 4. So why do we keep putting the sequencing framework slide up for discussion in our webinars? Is because what we really need is people to be very self-reflective on where have you submitted your application to be vaccinated. And if you do not belong in group 1, then just resubmit your application with the appropriate group. Your oldest record will be deleted and we'll work from the newest one you put in. It is our collective goal. We really want to make sure that we get to the highest risk people first in group 1 and then group 2. So prior to the reduction of vaccines, and appreciate this changes every day depending who's registered, we were well on our way being through group 1 and actually had started to book and vaccinate some people from group 2. So it changes depending on how many people are registered in a day. We just need people to be self-reflective and correct your application if you might have over-sequenced. So what do we need from people? And I thank you for turning my slide. The FAQs in the revised sequencing document is posted and available for people to go back and look at. We do need people to really think when you put your head on the pillow at night, am I at the same risk of COVID as those teams in the ED, the ICU, and the COVID units? And again, our goal is everyone who wishes to be vaccinated will be vaccinated. So it's not a matter of getting it, it's just a matter of who gets it first. The next slide really speaks to a very important message that we need people to remember. Part of the battle against COVID is being vaccinated. The most important message is the tools you have every day when you come to work or you're in the community. And that is to remember to wear your PPE as has been communicated. Absolutely everyone has a point of care risk assessment that as an individual you will do when you're caring for patients. Remember the principles of physical distancing and good hand hygiene. I have reminded a few people in the last 24 hours that the major risks that we're seeing amongst our teams is not from our patients, it's actually from each other. And it's easy to think, oh, my coworker in the break room, I know Susan, I'm good. No one's purposefully going out to get COVID. So it is people we don't suspect that may in fact be asymptomatic and passing on the virus. So these principles are super important every time you take your mask off to have food or drink. With that is the reminder, once you've had your lunch, put your mask back on no matter where you are. And the last message is not to forget when you get in a car with your colleagues or friends, in a car is considered closed conditions, you should also be masking there. So bottom line to this slide is really do everything you can in your own power to stay safe. So with that, I'm going to play hot potato back over to Aaron. Thank you.
Thanks very much, Leslie. I watched the media recently, and I'm sure many of you have seen nationally, there was a milestone celebration, or recognition is probably the more appropriate word, for the arrival of the first COVID positive patient in Canada. And it certainly dawned on me that this has been a long and very difficult year to get through. That work is hard, and I think more than ever, when we need help, we need to ask each other for it, and we need to support one another through this pandemic. I think as we head into the spring, we're going to see more and more of the broad recognition that we've all been at this for well over a year now. And Susan Fucciarelli, our Director of Health, Safety and Wellness, is with us today. And Susan, I think you're able to give us a bit of a presentation today on where people can turn for help as we see this, increasing recognition. But boy, what a grind we've all been through and continue to grind on through.
Absolutely. Thank you for that, Aaron. And today, coincidentally, is Let's Talk Bell's Let's Talk Day. So it's very timely that we're having this town hall today. Today actually marks the 11th year anniversary of Bell Let's Talk. So I would really encourage you, if at all possible, to look for resources that are on the hub. Certainly social media, you're going to see a lot today around Bell Let's Talk. And the goal is to promote mental health and raise awareness around mental illness and reduce stigma. Unfortunately, we still see that there is a lot of stigma attached to mental health issues and mental illness. And so what I wanted to provide to you today is an array of different confidential and free resources that are available to you as HHS employees and physicians and some of your family members to avail yourself of these services. I can just tell you that based on the number of resources that we have, I do hope that everybody will see something that will be appealing to them. On the hub, you'll know under our main page under the COVID resources, there is the pause, reset, and nourish. So we've got the resiliency, the resiliency support toolkit, and there are a number of different resources that are available to you there. And then also on the hub under the health, safety, and wellness area, you'll see the link to our SHINE program, which is supporting health in everyone. And there you will find a number of different resources specifically around mental health and supporting mental health and mental wellness. So if we can go to the next slide. Of course, we have pages and pages of resources that are available to you. So this is most definitely not an exhaustive list, but just wanted to highlight a few things that are available. So whether you are looking for something that is self-directed, or if you want to engage in counseling, if you want to read a book, if you want to talk to somebody, if you're in crisis and you need a hotline, there are all of those different services and resources that are available to you. First and foremost, just making sure that everybody is aware of our Employee Family Assistance Program. Again, this is available to you and to your family members, and it is a confidential service. There are an array of different topics that EAP can help with, from mental health and different symptoms that may be contributing to mental health or to stress. So be it anxiety or depression or some financial concerns. And we certainly know through COVID that has caused some anxiety for people as well. Also just want to point out a couple of other resources and services that are available that, again, in these times of difficulty for many people, and those particularly that are going through crisis, want to make sure that immediate help is available. So one of those services is COAST, which is the Crisis Outreach and Support Team. And these, again, are medical professionals that you can reach out to. They will go out into the community where needed, and will also provide support directly over the phone. There's also a program called Beacon, which is funded by the Ontario government and is currently free to all healthcare workers to support mental health. So those who may be dealing with stress or anxiety or depression, they are, again, staffed by mental health professionals who will provide therapy as it is needed. There's also St. Joseph's Hospital, our partner hospital here in Hamilton, that is offering COVID-19 mental health services for healthcare workers. Again, the contact information for all of these different resources available on our SHINE page on the hub, and you can reach out there to get more information. And also you can reach out to our Healthy Workplace Coordinator for Mental Health, Michelle Cassidy, and you'll see Michelle Cassidy's email here. So number of different resources that are available. We all need that support, and I would just ask that we support one another wherever possible. And certainly, if you do see somebody in crisis, please help them to get to these available resources. So with that, I'll turn it back to you, Aaron.
Thanks very much, Susan. So now we have time in our agenda for questions. Would ask everyone to please use the Q&A box to pose your question, or you can raise your hand. in the attendees forum, and we'll call on you to ask your question live. I would also remind everyone that there are resources available on the hub that you can access should you have a question. I know in particular related to the vaccine and the changes this week, we've made extensive updates to the FAQ based on the questions and answers that occurred this week at our town hall specific to that subject. So please check that out. We've circulated links via the dispatch as well and on the hub app, but you can navigate there and look at those. Dominic, I see there's a couple questions here that might be best for your expertise. One in particular related to whether or not the B117 variant was unique to the UK, or might it have adapted locally and now be present here, or what is the likelihood of an adaptation occurring locally?
Yeah, I mean, variants happening at all times, right? We said previously or in the past that it seems to be a virus that doesn't mutate as quickly as, for example, the flu. So we expected that the vaccines will work, despite the fact that every virus sort of develops those new variants over and over again. And if one results in a better fitness or can more easily transmit, then it may become more dominant over time. That's a process that probably happens everywhere to some extent, but as long as you don't have one strain that has a significant benefit over others, or is lucky enough to start spreading in a situation where, like in the example for Ireland and UK, once you release the major lockdown measures, you open up quite widely, and then you happen to have that strain by chance alone, mostly infecting those people who will spread it more, then you will see those shifts over time. So we are not aware of any variants that would have occurred in Canada that we would consider variants of concern at this point of time. And that's really the term that we need to keep in mind. There's many variants out there. It's the variants of concern, the UK variant being one of those. That doesn't mean that it may not happen at some point, but for the UK one, we don't even know whether it's originated in the UK. It's just where it was identified for the first time.
Perfect. There's another question in the chat box that you might have an answer for, Dominic. What about the issue of asymptomatic testing in our spaces? The question specifically is around, plans for asymptomatic testing in the community. Is there any consideration of going back to this or regular surveillance testing in hospital?
So quite frankly, at this point, I would be happy if at least all the symptomatic people would get tested. And I think we still have a gap there, unfortunately. As you are well aware, long-term care is doing this for a long time. They switched to weekly once our epi got worse and worse. And despite all that testing weekly, we continue to see outbreaks. So there's maybe some value, but relatively little value for asymptomatic testing to prevent outbreak in a healthcare setting, including long-term care setting, as long as there's other gaps. All of this being said, we see more of a role of more frequent testing, if at all, and that's something we would like to try, and that's where the PanBio, for example, so the rapid test antigen testing would come in, where we can do nasal testing rather than NPS testing, so not going all the way back in your nose. So these are technologies that we will or are planning to implement as soon as we can, probably focus on certain areas initially and see how it works. The data I've seen from long-term care, it's roughly 1 in 300 that come back positive with PanBio testing in the current setting. And 2 out of 3 of those that come back positive are true positives. So that's the other risk. You may test positive. You have a 1/3 chance that it was a false positive. So there's pros and cons to all of that, but we want to make our own experience with it and are planning to roll that out for asymptomatic testing among our staff and potentially also among patients in higher risk areas.
Thank you for that. Susan Pucciarelli, there's a question and a comment in our question forum about how people might, it's not incumbent on a person to wait until they're in crisis, before they can reach out for the help that they might need in terms of their wellness, well-being, mental health and well-being. I guess, could you talk a bit about what people can do proactively and what can leaders do to support their teams in a proactive manner?
Yeah, absolutely, Aaron. Thanks for that. And great comment. And that's absolutely correct. And anybody who's gone through the Working Mind program will know that we talk about mental health as a continuum. And so certainly when you are well, that's great. And it's how do you maintain that wellness? So whether it's through a physical fitness program or social supports or whatever the case may be, and then understanding where you may be declining and then where that additional support is needed. From an organizational standpoint, there's a lot, that's happening around the organization, both from Andrea Frolick's team through the Ecologies of Care program and the resiliency team, and also Michelle Cassidy, who is on the ground at the unit level and is providing support to teams and to units. So we're really trying to keep our finger on the pulse of what is needed around the organization, and then deploying the resources that we do have available to support those teams. Leaders and individuals can reach out to us, of course, if there are specific needs that are required. And again, we're doing our best to be proactive to provide that level of support to all of our team members.
Great stuff, thanks. I also want to point out just one of the resources that's available for families and parents. Our Master Children's Hospital team leadership has provided the Caring During COVID videos and resources that are available through the Master Children's Hospital website. I know I've had the occasion to take a look at some of those resources and share them as well with parents in my network, and I find them a real incredible resource. So just wanted to point out that for our viewers today too, that's there. So please check it out and share that on social media. Share your thoughts broadly on mental health and well-being today on social media as well. Very important to do so. I think maybe at this point, I'll transition us to our celebrations portion of our agenda, recognizing there might be questions we didn't get to today. As always, encourage everyone to check out what's available on the hub. If you don't see an answer to your specific question, you can always email it to the HHS news@hhs.ca inbox. We'll get you a response right away. So Rob, I see you've come on camera here to join me for our usual closer celebrations. Gratitude is always such an important part of managing through this pandemic. So everyone, please share. What do you have to be grateful for? What would you like to celebrate? You can call it out live, or you can type it into the inbox. Sharon Pearson, I see you coming on camera, so I presume you want to kick us off today.
Yeah, I do. Aaron, thanks very much. And I just, I was looking at the dates again for how long everyone's been at this work. And really, one of the first structures we established was the assessment center, and we're at day 353, I think, today of the assessment center, which is just staggering. And, coming up to that annual anniversary, and the whole team there has done an amazing job, have been so flexible, helping at the sites, helping in the long-term care and retirement homes with mobile testing. So I just wanted to give a shout out to that entire assessment team and Carolyn Meyer's leadership for keeping that structure going. It's been wonderful work, and they've done an amazing job.
Aaron, I thought I might just mention, we've got 8 units in outbreak across all of our sites today. And I think, the team that's been involved in managing those outbreaks has done a really wonderful job in terms of trying to understand how they happen, trying to manage them to an end, and so on. So to everybody who's been involved with outbreak management, I just wanted to give a shout out to those people who've done really yeoman's work.
Amazing. I see here in our chat forum from earlier on, call out from Jennifer Cotis to Michelle Cassidy and the resiliency team, you've done incredible work for our staff, very helpful to staff. They are awesome. So thanks, Jennifer, for sharing that.
See, we've got Bruce Squires coming off mute.
Thanks, Rob. Just in the context of our focus on mental health, want to give a shout out to the child and youth mental health teams across HHS who are dealing with really an unprecedented surge in the need for their services, right through eating disorders, emergency mental health, outpatient mental health associated with the pandemic, and those teams are really going above and beyond to support those kids and families.
Thanks, Bruce. Aaron, shout out from Deb Rackenjack. Thanks to our emergency department teams for their continued dedication to our patients during challenging times. Absolutely.
And here from Linda Aliberti, thank you to the ICU East South at HGH at Hamilton General Hospital. They've been caring for COVID patients for a year now, COVID positive patients for 1 year. They've done a phenomenal job of keeping our patients, their families, and each other safe, as well as providing outstanding care. Thanks for sharing that, Linda. Thanks to that team too.
I think we've got Kelly teed up.
Yeah, great. Thank you, Rob. I just wanted to acknowledge our HHS Capital team. Any kind of request from, gee, we need to set up an assessment center 353 days ago, or we need to set up a vaccine clinic in 2 days, or we need to expand capacity at the satellite health facility. The Capital team is there working day and night to make it happen. So I just wanted to extend my thanks to that team. Very grateful for the hard work that they put in, often on very short notice, particularly during the pandemic.
Very good. I see Dave's given a thumbs up as well. Thanks for that, Kelly. I see we have Lisa Rizzo in our attendees forum with a hand up. Lisa, I'm gonna send you a message right now that'll allow you to unmute and you can share your celebration with us. So why don't you go ahead now?
Thank you. I just wanted to send a shout out to all our CSS EAs and porters who work so hard to keep our hospitals clean and keep our patients moving. We're the ones that do a ton of work in the background. Thank you.
Thanks very much, Lisa. So true. Absolutely.
Another shout out to our lab staff across the city who've been doing literally hundreds of thousands of tests over the past year to make sure people know what their health status is. So yeah, that's a great shout out.
Wonderful stuff. Well, Rob, I guess we'll wrap it there. Thank you to everyone for participating. I'll leave it to you to provide some final remarks and see you next time.
Yeah, thanks very much, Aaron, and thanks all for, as always, for attending today. I think these town halls are an important way for us to, for the senior team to make sure that we're delivering the messages we think that are important, but also to hear from everybody about what's bothering them. So, for these celebrations and shout outs. So thanks all for attending today, and we'll see you all a week from now, if not sooner. Cheers.